Hey guys, how are you guys doing? I hope you guys are doing wonderful. I hope you guys are doing fantastic. So in today's video, I wanted to share with you guys what are the main differences between physiotherapy and physiotherapy assistant. I know you guys would love to know. I know some people have been asking me, what is the major difference between physical therapy and physiotherapy? So I'm going to let you in on all the juicy secrets in this video. Okay, so number one, physiotherapy. To be a physiotherapist, especially in the United Kingdom or even anywhere else, you need to have a full-blown degree. You need to have a degree to be able to work as a physiotherapy in the United Kingdom. In the United States, it's a doctorate degree. But to be a physiotherapy assistant in the UK, you don't actually need a formal degree. But in the United States, to be a physiotherapy assistant, you actually need to have an associate's degree, a 2-year associate's degree. And then another difference is that in the United States, to be a physiotherapist, after you do your 2-year, your 5-year or 4-year degree, doctorate degree, you need to also take the board exam. And once you pass your board exam, then voila, you can become a doctor in physical therapy. In the United Kingdom, however, if you are working, if you get your degree, your bachelor's degree or your master's degree as a physiotherapy or physiotherapist, you can go straight on and work in the National Health Service or in a nursing home or wherever you choose to work. But in order for you to be a physiotherapist, you need to have a degree. To be a physiotherapy assistant in the United Kingdom, you don't need to have a degree. You can do an apprenticeship or you can do like a learning on the job kind of thing where you're working and they're teaching you all the skills you need to know. In the United States, however, to be a physiotherapy assistant or physical therapy assistant, you would need to have an associate's degree. So the other thing about physiotherapy or physical therapy and physical therapy assistant is the fact that the physiotherapists are the people that actually make a lot of the decisions. So if a patient is ill and they come to the hospital, the physiotherapist is the first person they're going to see that will do an assessment to see what is the problem with the patient and what are the treatments that they're going to need. And then after the physiotherapist has done this initial assessment, then they can hand over to the physiotherapy assistant to continue with the exercises and to tell them how the patient is improving or maybe not improving with the exercises. So the physiotherapists actually, they have more of a stake in that. They have more of the decision-making power. So basically, if you are someone that like to be in control, that like to be the one that is like the boss or the one that makes all the judgment or calls regarding the patient, then you might want to look at becoming a physiotherapist and not a physiotherapy assistant. But if you want sort of an easy life or a more relaxed life, then maybe being a physiotherapy assistant might be better for you. I've actually known some physiotherapy assistants or occupational therapy assistants that they just found that the job was too stressful for them. They were happy being an assistant and not having too much responsibilities. Another thing is the fact that as a physiotherapist, you would need to sign all your notes. So, and if there is any discrepancy or if there is any mistakes regarding the patient, you will be held liable and you would be held accountable.